Did you know that heart attacks in women often go undetected, yet they are one of the leading causes of death worldwide? Although cardiovascular disease is typically associated with men, recent statistics reveal a startling reality. Women are at just as much, if not more, risk. Why, then, are symptoms in women so often missed or misdiagnosed? How does a heart attack in a woman differ from that in a man? These are critical questions we must address. In this video, we'll explore the hidden symptoms of an impending heart attack in women, identify those at risk, and discuss crucial prevention strategies. Understanding and sharing this knowledge can make a difference and save lives. Join us to uncover what every woman needs to know about her heart health. According to the American Heart Association, heart disease is the #1 killer of women, causing 1 in 3 deaths each year. This equates to approximately 1 woman per minute. Contrary to popular belief, women are just as susceptible to heart disease as men, and some types of heart disease are more common in women. The statistics become even more alarming if we look at the details. Almost 45% of women aged 20 years and older suffer from some form of cardiovascular disease. The study found that among women who had heart attacks, 64% of women who died suddenly from coronary heart disease had no previous symptoms. Women under age 65 who have a heart attack are more likely to die within a year compared to men the same age. Stroke, a related cardiovascular disease, disproportionately affects women. Every year, women have more strokes than men, and more women die from stroke than men. In addition, risk factors for cardiovascular disease may differ between men and women. For example, factors such as mental stress and depression affect women's hearts more than men's. In addition, smoking is a more potent risk factor for cardiovascular disease in women than in men. The American Heart Association also emphasizes that women often experience different heart attack symptoms than men. Instead of classic chest pain, women may experience completely other symptoms that are difficult to recognize if you don't know them. These statistics and results highlight the importance of awareness, proper diagnosis, and treating cardiovascular disease in women. By recognizing the unique aspects of cardiovascular disease in women, we can take steps toward more effective prevention and treatment strategies. Symptoms. Now let's talk about hidden symptoms of heart attack in women. Heart attacks in women can present with a range of symptoms, some of which are less commonly known and can be quite different from the classic symptoms often associated with heart attacks in men. Understanding these hidden or less typical symptoms is crucial for early detection and treatment. Here's an in-depth look at these symptoms. Chest pain or discomfort. This is the most common heart attack symptom in men and women. However, women are more likely to describe it as a pressure or tightness. This pain is not always severe or the most prominent symptom and can be mistaken for heartburn or indigestion. Fatigue. Unusual. Fatigue can occur days or weeks before a heart attack. Women may feel tired without exertion and find that the fatigue persists even after rest. Shortness of breath. Women may experience this without chest pain. It can feel like they've run a marathon despite not moving. Breathing may become difficult while resting or lying down. Back, neck, jaw, or throat pain. These areas can ache during a heart attack, and the pain can fluctuate in intensity. It's often unexpected and can be mistaken for muscle pain. Nausea or vomiting. Women are more likely than men to experience these symptoms, which are often mistaken for a stomach ulcer or flu. Pain in the lower chest or upper abdomen. This can be mistaken for heartburn, a gallbladder attack, or stomach ulcer. Dizziness or lightheadedness. Feeling faint or dizzy without reason can be a sign of a heart attack, especially if accompanied by other symptoms. Sweating. Breaking out in a nervous, cold sweat is common among women who are having a heart attack. It's often confused with stress-related sweating. Heart palpitations. An irregular heartbeat or feeling like the heart is skipping beats can occur during a heart attack. Sleep disturbances. Women may experience unusual sleep disturbances in the days or weeks leading up to a heart attack, including insomnia or feeling sleepy during the daytime. Anxiety. Women may feel a sense of doom or fear before a heart attack, often described as a feeling that something is not correct. It's important to note that these symptoms can vary significantly among individuals, and not all women who have a heart attack will experience all these symptoms. Some women may experience mild symptoms while others may have more severe and classic signs. The key is to be aware of what's normal for you and to seek medical attention if you experience unusual or persistent symptoms. Remember, in the context of a potential heart attack, it's always better to be safe and seek medical evaluation promptly. Group of risk. Identifying high-risk groups for heart attacks in women is crucial for prevention and early intervention. Several factors increase the risk of heart attacks in women. Age. Women over the age of 55 are at a higher risk, particularly after menopause, when the risk of heart disease increases due to the reduction in natural estrogen levels. Family history. A family history of heart disease, especially if a parent or sibling was diagnosed with heart disease at an early age, significantly increases risk. High blood pressure. Hypertension is a significant risk factor. The risk is even higher if blood pressure is uncontrolled or poorly managed. High cholesterol levels. Elevated LDL, bad cholesterol, and low HDL, good cholesterol, levels increase the risk of heart disease and heart attacks. Obesity and overweight. Excess body weight, especially around the waist, increases the risk of heart disease. Physical inactivity. A sedentary lifestyle contributes significantly to heart disease risk. Smoking. Smoking is a significant risk factor for heart disease in women, and the risk increases with the number of cigarettes smoked per day and the length of time one has been smoking. Diabetes. Women with diabetes are at a higher risk of heart attacks than men with diabetes. Mental stress and depression. These factors affect women's hearts more than men's and can contribute to higher risk. Pregnancy complications. A history of pregnancy. Complications like gestational diabetes or preeclampsia can increase a woman's long-term risk of heart disease. Menopause, early menopause, before the age of 40, can double the risk of cardiovascular disease. Inflammatory diseases. Conditions like rheumatoid arthritis or lupus can increase women's heart disease risk. Poor diet high in saturated fats, trans fats, salt, and sugar can raise the risk. Excessive alcohol consumption. Drinking too much alcohol can lead to a rise in blood pressure and cholesterol levels. Birth control pills. In some cases, particularly in women who smoke and those over 35, the use of birth control pills can slightly increase the risk of heart attack. Women need to be aware of these risk factors and discuss them with their healthcare providers. Regular checkups and lifestyle modifications can significantly reduce the risk of heart disease, especially for those in high-risk groups. Prevention. Preventing heart attacks in women involves a combination of lifestyle changes, medical interventions, and awareness. Here are critical strategies for heart attack prevention. Maintain a healthy diet. Focus on a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit saturated fats, trans fats, sodium, red meat, sweets, and sugary beverages. Include foods high in omega-3 fatty acids like salmon and flax seeds. Regular physical activity. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week, combined with muscle-strengthening exercises. Even short bouts of activity can add up to the total goal. Manage body weight. Maintain a healthy weight to reduce the strain on your heart. Calculate your body mass. Index BMI and waist circumference to understand your ideal weight range. For your information, the risk of heart disease and type 2 diabetes increases with a waist measurement of more than 35 inches, 88 centimeters, for women. Quit smoking. Smoking cessation is crucial as it significantly reduces the risk of heart disease. Seek support programs or treatments to help quit smoking. Control blood pressure. Regularly monitor blood pressure. Manage high blood pressure through diet, exercise, and medication if prescribed. Manage cholesterol levels. Get regular screenings to keep track of cholesterol levels. High cholesterol can be managed through diet, exercise, and medication. Monitor and manage diabetes. If you have diabetes, keep your blood sugar levels under control. Regular checkups and adherence to diabetes management plans are crucial. Limit alcohol consumption. Stick to moderate alcohol use, up to 1 drink a day for women. Reduce stress. Engage in stress-reducing activities like meditation, yoga, or deep breathing exercises. Maintain a positive social network and seek support when needed. Regular health screenings. Regular checkups are crucial for monitoring heart health. Discuss the frequency of cholesterol, blood pressure, and diabetes screenings with your doctor. Consider low-dose aspirin. For some women at high risk, doctors may recommend low-dose aspirin. However, this should only be taken under medical supervision. Be aware of heart attack symptoms. Recognize the symptoms of a heart attack and don't hesitate to seek medical help if they occur. Hormone therapy and birth control pills. Discuss the risks and benefits of hormone therapy and birth control pills with your doctor, as these can affect heart health. Pregnancy-related issues. Women with a history of pregnancy complications should monitor their heart health closely. Educate yourself and others. Stay informed about heart health and spread awareness among family and friends. Preventing heart attacks in women is about making conscious, healthy choices every day. It's important to understand your personal risk factors and work closely with healthcare providers to manage them. Remember, many aspects of heart health are within your control. Conclusion: now you are informed. You can easily understand whether you are at risk and will be able to adequately recognize not only the obvious, but also the hidden symptoms of a heart attack. This knowledge is your key to health and well-being. Be attentive to your body and do not ignore the signals it sends you. Your awareness and timely actions can save a life, possibly your own. Our channel is created to inform you about the latest trends in health and proper nutrition. Subscribe to our channel, and we will help you turn the recommendations for a healthy lifestyle into your daily habits.